The liver is an essential organ responsible for a wide range of functions, including detoxification, metabolism, and the production of important proteins. While many medications are crucial for treating various health conditions, some can have adverse effects on liver function, leading to liver damage or even failure. Understanding the risks associated with certain medications is vital for anyone taking prescription or over-the-counter drugs. This article will explore 10 popular medications known to potentially cause liver damage, highlighting their mechanisms, risks, and safer alternatives. 1. Acetaminophen. Tylenol. Acetaminophen is one of the most widely used over-the-counter pain relievers. While it is effective for managing pain and reducing fever, excessive use can lead to severe liver damage. Mechanism: acetaminophen is metabolized in the liver, and high doses can overwhelm the liver's ability to process it, resulting in the accumulation of toxic metabolites. Risks: taking more than the recommended dose, typically 4,000 mg per day for adults, or combining it with alcohol significantly increases the risk of liver toxicity. Safer alternatives: nonsteroidal anti-inflammatory drugs. NSAIDs, such as ibuprofen or naproxen, can be alternatives for pain relief, though they also have their risks. 2. Statins. Statins are a class of medications used to lower cholesterol levels and reduce the risk of cardiovascular diseases. While they are generally well tolerated, some individuals may experience liver-related side effects. Mechanism: statins can affect liver enzymes and may lead to elevated liver enzyme levels, indicating potential liver injury. Risks: regular monitoring of liver function is recommended for patients on statins. In rare cases, statins can cause severe liver damage, particularly when combined with other medications or in individuals with pre-existing liver conditions. Safer alternatives: lifestyle changes, such as diet and exercise, can help manage cholesterol levels, and other lipid-lowering medications may be available for those who cannot tolerate statins. 3. Antibiotics. Amoxicillin clavulanate. Amoxicillin clavulanate is a commonly prescribed antibiotic used to treat various infections. While effective, it can lead to liver damage in some patients. Mechanism: the combination of amoxicillin and clavulanate can cause an immune-mediated reaction that leads to liver injury. Risks: symptoms of liver damage may include jaundice, fatigue, and abdominal pain. Liver function tests should be monitored during treatment. Safer alternatives: other antibiotics, such as azithromycin or doxycycline, may be prescribed depending on the infection type and patient history. 4. Anti-tuberculosis medications. Isoniazid and rifampin. Isoniazid and rifampin are first-line medications used to treat tuberculosis (TB). Both drugs can cause liver toxicity, particularly when taken together. Mechanism: these medications can induce liver enzyme production, leading to hepatotoxicity, especially in individuals with pre-existing liver conditions. Risks: regular monitoring of liver function is recommended during treatment. Patients may experience symptoms like nausea, vomiting, and jaundice. Safer alternatives: alternatives may be available depending on the strain of TB and individual patient factors, but the use of these medications is often necessary for effective treatment. 5. Methotrexate. Methotrexate is a medication commonly used to treat certain cancers, autoimmune diseases, and ectopic pregnancies. While effective, it can cause liver damage with long-term use. Mechanism: methotrexate can lead to hepatic fibrosis and cirrhosis, particularly in patients with pre-existing liver conditions or those who consume alcohol. Risks: liver function tests should be performed regularly in patients taking methotrexate to monitor for signs of liver damage. Safer alternatives: for some conditions, biologic therapies or other disease-modifying anti-rheumatic drugs (DMARDs) may be appropriate alternatives. 6. Nonsteroidal anti-inflammatory drugs. NSAIDs. NSAIDs, including ibuprofen and naproxen, are commonly used for pain relief and inflammation reduction. While generally safe, they can cause liver damage in rare cases. Mechanism: long-term or excessive use of NSAIDs can lead to liver enzyme elevation and, in extreme cases, liver failure. Risks: patients with pre-existing liver conditions or those taking high doses are at a greater risk. Symptoms of liver damage may include abdominal pain and jaundice. Safer alternatives: acetaminophen is often considered a safer alternative for pain relief, although it carries its own risks. 7. Anti-epileptic drugs. Valproate. Valproate is commonly prescribed for epilepsy and bipolar disorder. It is known to have potential hepatotoxic effects, particularly in specific populations. Mechanism: the liver metabolizes valproate, and it can lead to an increase in liver enzymes and, in severe cases, liver failure. Risks: risk factors for liver damage include concurrent use of other hepatotoxic medications, underlying liver disease, and genetic predispositions. Safer alternatives: other anti-epileptic drugs, such as lamotrigine or levetiracetam, may be used based on the individual's condition and response. 8. Herbal supplements. Kava and comfrey. Certain herbal supplements, while marketed for various health benefits, can pose significant risks to liver health. Kava and comfrey are two notable examples. Mechanism: kava has been associated with hepatotoxicity, potentially causing severe liver damage. Comfrey contains pyrrolizidine alkaloids, which can lead to liver damage and cancer. Risks: the use of these supplements can result in acute liver failure, necessitating liver transplantation in some cases. Safer alternatives: always consult a healthcare provider before using herbal supplements, and consider safer alternatives like omega-3 fatty acids or milk thistle, which may support liver health. 9. Antidepressants. Nifazodone. Nifazodone is an antidepressant that has fallen out of favor due to its association with liver toxicity. While effective for treating depression, its risks can outweigh benefits. Mechanism: nifazodone can cause dose-dependent liver enzyme elevations, which may lead to liver failure in rare cases. Risks: patients taking nifazodone should be monitored for liver function, especially those with existing liver conditions or those taking multiple medications. Safer alternatives: other antidepressants, such as selective serotonin reuptake inhibitors SSRIs like sertraline or fluoxetine, may be safer options for managing depression. 10. Anabolic steroids. Anabolic steroids are synthetic derivatives of testosterone used to promote muscle growth and enhance athletic performance. They can have serious effects on liver health. Mechanism: oral anabolic steroids can cause liver damage, leading to conditions such as peliosis hepatis, blood-filled cysts in the liver, and hepatocellular carcinoma, liver cancer. Risks: the risk of liver damage increases with the dosage and duration of steroid use, particularly in individuals with existing liver conditions. Safer alternatives: for individuals looking to enhance athletic performance or muscle mass, safer training and nutritional strategies are recommended rather than resorting to anabolic steroids. Conclusion: while medications are essential for managing health conditions, it is crucial to be aware of their potential side effects, particularly regarding liver health. The 10 medications discussed in this article: acetaminophen, statins, antibiotics, amoxicillin clavulanate, anti-tuberculosis medications isoniazid and rifampin, methotrexate, NSAIDs, anti-epileptic drugs valproate, herbal supplements kava and comfrey, antidepressants nifazodone, and anabolic steroids highlight the importance of careful medication management. If you are taking any of these medications, it is crucial to discuss your liver health with your healthcare provider. Regular monitoring of liver function tests can help detect any issues early, allowing for timely intervention. Additionally, adopting a healthy lifestyle such as maintaining a balanced diet, avoiding alcohol, and engaging in regular exercise can further support liver health. Always communicate openly with your healthcare provider about any concerns regarding medications and their potential side effects. By staying informed and proactive, you can help protect your liver and overall health.